This week on The Beauty Standard, Nicole Gregory is joined by Ashack. Kurt is Vice President of MISpa, Michigan's Medical Aesthetics Association, as well as being an MD and board-certified dermatologist. Kurt and Nicole dive into the world of men's medical aesthetic treatments, including laser, chemical peels, and filler. Stay tuned to learn how you can save on any treatment mentioned in this episode with an Urban U holiday tier.
Welcome to The Beauty Standard with your host, Nicole Gregory, Urban U CEO and medical spa industry key opinion leader. A podcast where we bring you thought leaders, experts, and trailblazers who are setting the standard in the beauty and wellness industry. We bring you the latest trends straight from the source before they go mainstream. So grab your coffee or wine, come relax with us, and be prepared to be inspired.
Hello, everyone, and welcome back to The Beauty Standard. Today, we are excited, as you've heard, Kurt's profile and credentialing, but Dr. Kurt Ashack, welcome.
Thank you for having me. I'm excited to be here.
Well, hey, so I've known you for a little bit, and I always enjoy our conversations, something to learn so many times that we've had conversations. It's kind of led into how you got to where you are right now. And I think it's an interesting story because it's kind of like a legacy story in regards to your family. So I'd love for you to tell everyone why and how you got into your business.
Yeah, definitely. Well, Dr. Kurt Ashack. I'm from Grand Rapids, my dad's was a dermatologist for over 30 years. And so I always was interested in medicine growing up. I went to Hope College in West Michigan and then Michigan State for medical school. And then in medical school, that's where I always thought I wanted to do dermatology. I always wanted to kind of be like dad growing up. And then, but I kind of got exposed to everything, which I liked everything. And dermatology is a very diverse field. You help people every day with, cosmetic things, skin problems, skin cancers, that type of thing too. And every day is different. So that kind of drew me into it because I get to do cosmetic stuff, which we'll talk a lot about. I get to just, see, patients for skin checks and rashes and things like that. And I do surgery. So I use laser-based devices. So it's kind of like an AED specialty. And I like it just because I do such a variety of things. And so it's never boring and every patient's different. And I was lucky enough to get to, come back to Grand Rapids, Michigan and work with my dad for a few years before he retired and then kind of took over, a lot of his patients. And that's got me here today.
Well, I love you telling that story because I always tell my kids, you do what you see. So if your parents or family are in, doctors or dermatologists, you're going to see it, you're going to do it, you're going to hear it around the dinner table. If your family is a group of entrepreneurs or whatever it might be, you're going to do what you see. When you were growing up, was there one thing you're like, oh, that's really cool? Or did you just like the science part of it?
I don't know. I think it was always the pictures we would see. He'd bring home these books of skin diseases, and my brother and I would always show our friends these nasty rashes or infectious things and stuff. And so I don't know. It never grossed me out. I was always intrigued by it, and I always wanted to know more. So just being exposed to it all the time. He didn't necessarily always talk about it every day with us, but as I got further along the line, my education, it's kind of became, it's almost like the way we bond too, right? I mean, this is one of the bigger commonalities we have between each other, which is kind of nice. So I think that's kind of what drew me the most, is it just brought me closer to him over time because it's something we could share, his legacy, and I can kind of carry it on for him too.
Yeah, no, that's great. I love that because our future starts with our roots, right? So you have to kind of go backwards sometimes to appreciate it, to go forward. And then talking more specifically, like you said, you're in medical aesthetics.
Yeah.
I know when your dad was practicing it, it's around, it was still part of the practice, but like you said, what really drew you to it? I mean, in medical aesthetics, there are a lot of, I'd say, female practitioners, compared to a lot of derm. I mean, I guess I'm curious as to what was I want to do that rather than looking at the really gross stuff, like you said, that can come up from dermatology.
Yeah, definitely. Just, so in my practice, cosmetics isn't the largest portion I do, but it's still definitely something I enjoy doing. But it's just, I feel like it's more because people, you can have an internal condition like diabetes and people don't see it, so they don't care, right? But just when it comes to your skin, if you have acne or acne scarring or any defects in the face, it's something people look at every day, and just helping improve little subtleties that they have to look at. improves their confidence and their, how they kind of go about everyday life. And I have a good example of a patient I just saw today that we can talk about too down the, further in the talk. But why, I also think that it's like you said, there's a lot of women in dermatology is a little bit more of a majority of women than men. And then even when you look at the aesthetics, it's even, smaller, at least like from what I'm aware of. There's probably like, 3 women to every man, or maybe more than that in terms of like, doing medical cosmetics and dermatology. And so, and I think part of that, which we'll talk about, men and aesthetics, that drew me to it because I like taking care of my skin. I have a routine. I like my skin to look good. I do like things like Botox or Dysport, and like facials and lasers and all that good stuff. And I feel like having men in aesthetics draws other men to there because it's always been a thing that guys don't come in unless their wife sends them in. But people, they care about it because I'll get people in and they'll make up things saying that their wife said, "Oh, I want to ask about this," or my wife wanted me to ask about this. But they really are the ones that care about because I'll ask the wife too because I'll usually see them next. But just guys want cosmetic things done, and it's becoming more and more acceptable now as gender boundaries are breaking down. Because it used to be guys didn't care what they looked like, what their haircut looked like. They just kind of shave their own head type of thing. And now we care with social media, kind of bringing that more to light too. And so I think being, a male voice in the space is helpful to bring other men, to kind of say, hey, guys need to care about your skin too. Your wife has to look at you. Your other, your spouse has to look at you every day, and we should be taking care of ourselves. I mean, it's okay to do cosmetic things too as a guy.
Mm-hmm. No, I think you are actually granting a lot of permission to people without them even knowing that you're granting permission by just the words you just said. Like, it's okay. Because we do look at ourselves a lot more in social media, Zoom effect, all this that we're doing now. Well, I'd love to hear the story you're going to tell. So you plug it in whenever you think it's right. But I would say you're 100% right. Like men in general, like the aspect of wellness isn't always something they think about. But do you find medical aesthetics isn't just about looking, good, but it's about the wellness, like the confidence, I just think like when you are in this industry, I know people go too far with it, far with the procedures, but I see a lot of that backing off and more the natural look, which now does allow men and a lot of diversity because it's like, wait, you don't have to have all this augmentation. It's backing into more of the wellness space. Do you feel that as well?
Yeah, I mean, it builds confidence and it goes along with the wellness too. I agree with that. And I think showing that there are subtle things you can do. Not everything needs to be like very like plump and like noticeable. Like you point to that person got something done. I mean, most of the things we're fixing are like little defects like acne scarring, which is the patient. So I can use that as I guess a segue to kind of talk about my patient today. So he was an older gentleman. He was in his 60s. But he had like some significant acne scarring from when he was younger, and he said it's been for 20 years or more than that, it's been bothering him, and he just didn't know there was a lot he could do. And now he's kind of finally to the point where like other people told him that there's some cosmetic things, and he talked to some plastic surgeons, and then he eventually found his way down to me, and we did some filler for some of his acne scarring, but just kind of seeing like the instant gratification of that filling up. It's like literally like every day, like this is like what I focus on. Like doesn't matter anything else about his health, right? It's just that's what he sees, and those are like the imperfections, and he doesn't, he fixates on it every day. And so just kind of being able to improve someone's confidence does help their well-being. Because otherwise, that can lead to like anxiety, depression. You're like everyone's always focusing on the spot, even though they're not, right? I mean, that's what we think. But just it kind of, from there, then it gives them confidence. With well-being, because you can exercise and things like that, but people still don't think they're they're not quote unquote perfect, but like they feel like there's still something missing if they have something on their skin that they feel like they're constantly noticing every day and people are focusing on.
Well, and I have I have 5 teenagers, and one of them she's chosen not to do any type of Accutane, and I just had a conversation with her yesterday. I'm like, so does that bother you? And she said, no, I think it bothers you more, Mom. I go, only reason I'm thinking is because she's, well, you have good skin. And I said, well, I've never had acne. Like I just have that skin. And your other siblings, some have had it, some haven't. But tell me what that means to you. She goes, I don't think that much about it. To your point, I don't think people are thinking about it all the time. She goes, but it is one more thing to think about. And so
Yeah.
I said, well, what if you could get rid of that one more thing to think about? It's not just sitting there on your shoulders, and you now could just focus on one more new thing or one more proactive thing.
Right.
She's like, yeah, maybe I should try it. Like, she had never really thought of it that way. She was like, oh, that's just there,
Yeah.
So I don't know if you kind of feel that same
Yeah.
way. It's probably what you're just saying,
Yeah.
right?
Yeah, exactly. And that's why I tell people too is like I can fix your acne easier than I can fix your acne scarring. So I can't. I mean, once you have the scarring, you have to do more surgical procedures or filler things like that. Now, is exponentially more expensive too than going through like a course of Accutane or getting on a good skincare regimen for your acne too. So yeah, I fully agree. Just taking care of the problem. But I know, and that's the thing is some people, it doesn't bother them, but then if they see the after effect, which they might not see right now, then they're going to be unhappy later. And so that's why I say, like, it's so much easier if we can just kind of get you jump started and just start doing things to take care of your skin. You will be a lot happier because while you might be younger and you don't care as much now, there's probably a certain point in life where you might start caring about it. So just better to try. Yeah. Yeah.
Like, he thought about it. Yeah, that's
Yeah.
that's interesting. Those two
Yeah.
opposites. So when you're talking about men, what are some of the most popular procedures that you're seeing for men?
So for me, it's most commonly, I'll say number one for me is like laser. So especially sunspots and then, like the blood vessels or redness on the face. That's probably like what drives men the most nuts, whether it's from rosacea or sun damage for the redness, and then just, sun damage for the sunspots. So we do a lot of, like a version of BBL, IPL laser for the sunspots. I do a lot of vascular laser for the vessels like on the nose or like on the cheeks. Like a lot of guys don't like that either. And then I actually do quite a bit of Dysport or Botox for men too. So that's definitely number two, pretty close behind the lasers. It's one of those things where they usually will come in. I get a few men that come in on their own and they're like, I want this done. But most of them will come in and be like, my wife told me to try this because she does it. Whether that's, them wanting to do that and that's what they're blaming it on or not. But and then they always like it after the fact because then when you see the wrinkles are lessened and at rest and they're gone, they start, then they start coming back more and more. Filler, I do have a few patients with filler, but that's, probably much less common than Dysport or the laser stuff. And then otherwise, like, like the chemical peel stuff and things like that too, is somewhere in between laser hair removal. But for sure, lasers and then followed by Dysport and then filler.
Okay, love it. Yeah, no, I think you're right in general. So first of all, what is the condition of the nose? Because I do see that a lot, and you're like, that's like the number one thing that bothers men sometimes. I mean,
The like runny nose.
Yeah.
Yep,
The running.
rhinophyma.
Yeah.
Yep,
Sorry.
it's called rhinophyma. It's an overgrowth of oil glands on the nose, which is usually like a part of like a rosacea. It's like a subcategory of rosacea. So, and you usually see it in men more than women, probably because the men that do it don't take care, don't have like a skincare regimen, don't care, and just they come in after the fact. But the treatments for that actually look phenomenal. So that I don't do any of that. I usually send to a plastic surgeon. And you can use like something called loop cautery or like a CO2 laser for it too. But the results are phenomenal because you basically just got to recontour the nose and melt the oil glands away. But you can get that anywhere. Like I've seen it on the chin or on the forehead, but the nose is the most common. But just I do get asked that a lot. But then when I explain the procedure that you need to get done for it, most guys are like, you know what, I'm like 70, I'm fine. But like I have a few guys that went and and go through with it and show me the before and afters, and they're like super happy after because again, it's a confidence thing.
Mm-hmm. Well, and to your point though, like if you start, like there's no better time to plant a tree than today, right? So like if whatever age you are, if you start doing something, but if you're young and a young working professional or in college or whatever with like you're not going to have to deal with plastic surgery down the road. And I think that's the thing is, over the course of time, I think it's also a set of social beliefs, right? Where there's like, oh, men aren't supposed to do these things. And, or just in general, like we're not supposed to take care of ourselves. Well, that's interesting. The services that men want, because I do believe they're very similar to women, but women are probably more on the neurotoxin side first. But I don't know about you, if you find this, like getting someone in for a facial, whatever gender, wherever they might be, is like the easiest and best thing. So anyone, listening can like, okay, where do I start? Just come in for, right to your organization or ours and like get a consultation, do a facial. It's like super easy. It's pain-free. You'll come out feeling a little bit more confident, right?
Right, exactly.
Self-care doesn't end in location at Urban U. Purchase medical-grade skincare to use at home by shopping on Urban You For Me, your one-stop shop for skincare delivered right to your door.
I want to introduce everyone to start.
Yeah. I think another thing is now that, I think two things. Social media is definitely part of why, like, I feel like younger generations are being better about, especially like with respect to men, like taking care of their skin and seeking out these things. But then, like you said, planting the seed now, a lot of people will like look at their, parents' generation or their grandparents and see like the like ruddy nose or like the sunspots everywhere and say, I don't want those. Like I watched my, like dad not take care of himself or, your parent not take care of themselves. And then that also makes them say, I don't want those things. So how do I like prevent it now? So, and then preventative aging is also becoming a big thing too. I feel like there's like a big push in aesthetics for preventative aging. So you see like those wrinkles in your grandparents, and you're like, how do I not get those? Well, you start younger, and then you just kind of prevent the rusting lines from happening in the first place. So we're seeing a lot more younger patients coming in too. But just it's a cost thing too. So sometimes they can't always afford it, but they're seeking those things out.
Yeah, no. Well, and like you said, it's kind of Pandora's box is open in regards to people asking questions and, trying different procedures. Well, I know we've talked a little bit about men. Anything else you want to share then, like in regards to procedures or understanding? And I know it's hard. Like there's not a lot of male HCPs, healthcare professionals like yourself out there. So men probably feel super comfortable with you because you can have this nice, normal conversation. Do you ever have to put someone at ease? Like you said, maybe their spouse recommended them to come in, but do you feel because you're a male, doctor, like that makes it a little bit easier for conversations?
It does, because I tend to get more of the guys that want like the like neuromodulators or like filler and stuff. They usually get sent my way. I feel like they probably feel more comfortable too, because then they know I do it, and I'll share things like oh yeah, I'm overdoing my neuromodulators as well, and I feel like that helps put them at ease too. But yeah, I think the biggest thing, and we've talked about this before, is just saying like it's okay to get these procedures done, and I think the biggest thing for guys is always they don't want a lot done. They don't want it to look like they had things done, and they don't want like downtime. And most of these things we've talked about have like no downtime. I mean, neuromodulators, you can basically go about your life right after. You might have like a few blubs for that day, but just no downtime for that. The lasers are red for like a few days. Filler, like same kind of thing. Maybe some bruising, but most of these things like we do, so well that you can hardly even tell you had things done too. And I think just letting the men out there know that just these are quick procedures, they're relatively painless, the results are pretty quick, and also like even it's not like there's no downtime and no one's gonna go around pointing fingers like you got something done type of thing. I think that's like more reassuring for them too to know and like be okay with doing these procedures.
Mm-hmm. No, you're 100% right, because it's what it was that they've seen so many bad things on social media, bad outcomes. It's like, oh my God, I'm not doing that. But to your point, like I think understanding the what's going to happen in that procedure. Some, not even meant just anyone who's new to medical aesthetics is like, what's going to happen here? So education there, and then education as to, what you need to do after. What I want to ask this question, and then I want to go to talking about like kind of specific things around procedures. But so have you had any movement with body sculpting, like for men? Like, is that something you're seeing as well when you look at medical aesthetics? It's not just face, right? It's all the other areas.
We just because we don't have the like cool sculpting or anything like that. Like we don't get a lot of that, but I don't get people asking that though. At least in my office. I mean, maybe they're already going to like the plastics offices around the road asking about it too. Because I'm seeing more and more like people advertising. But again, with women, I'm not seeing like a lot with men. But no, I feel like for guys, at least that like what I've seen, it's still focused more on like the facial stuff too. But again, I mean that could be because they're always lagging. Because I mean, women are always like, all right, we've already keep up with these things, and like now what else can we perfect type of thing. And guys, they aren't at that point yet. At least the ones I've seen. So, but yeah, so I don't have too much to comment on that part.
No, it's just interesting to see where and what's popping up for everyone. But I would say, I guess I want to talk a little bit about like, so you're a runner. Congratulations on all your success. I love that we follow each other because I get to see. I always say, "Oh, you qualified for this." You're like, "Actually, no, it was for this better one." I'm like, "Oh, okay." I still am interested. But there is something such as runner's face, which I want to talk a little bit about. So you're losing, obviously some of that collagen and other things such as when people lose weight, like everyone's doing all these diabetic Mozempic and whatever they are, Manjaro, right? And that's called there's like so much loss of volume in the face. So in regards to the running, not saying that you have it because you look great, but on the other side of it is people losing dramatic weight right away. Like from a doctor standpoint, what's happening? And what is that like? How do you fix that, or what can you do to fix that? Is it just time?
So yeah, I do have it. That's why I'm like, I always, whenever I see pictures of myself running, and like depending on the gravity, like my cheeks go down. I have like a large defect in my cheeks. So I do need filler, but I haven't jumped there yet. But especially with, I can always tell when people are on those like new medications now too, because you lose more of like what's called peripheral adiposity, so like peripheral fat first. And especially kind of like in the face, and then like the central fat is probably like not necessarily going away. So usually you'll see people's sunken face first. They might be skinnier too, but you for sure like lose that fat as well. And it's no different. It's just accelerated versus what happens with aging. So we have in our face what's called fat pads. So you have like little collections of fat all over the place. And in your 20s to 30s is when that starts to break down. And so like a lot of these activities that we're doing probably just kind of accelerate that in general. And then especially when you're on those medicines, like that's the fat that like disappears. And so you get this giant volume loss in your mid face or your cheek. I always call it the ghost face for me because I feel like I look like the old scary movies ghost, the like I know what you did last summer like face type of thing. But just it's so you lose fat, and then in addition to like aging, you end up losing bone too in the same areas. But that loss of fat is what creates that sunken cheek, and that leads everything to kind of go down with gravity, and so then that can like go down to even like the jowls and whatnot too. So really filling this mid face with filler is like the main thing you can do to kind of plump that area back up, lift everything back up, because all that fat is completely gone or almost completely gone, and so just you have that like kind of almost like a dip. So like if you look, because for guys, we want more of like a structured jaw face. For women, you want more of a rounded face. But then if you like look in the middle, you'll see kind of like a depression in there. And so that's what we're missing, and that's what needs to be filled. And so that's where like something like Sculptra can be helpful too, or just like any filler in general can kind of fill that space and make it look better.
So, well, I want to jump into that just real quickly. So, Sculptra and also SkinVive, those are more like skin health. So I want to talk about skin health in a second, just like the quality of skin health.
Yep.
But then on the the other side of it, when you lose those fat pads, is that something you lose then forever? Like you can't, it won't come back, right?
Right. I mean, it lets you gain like weight. You probably get some like of it back, but like in general, no. Like once you lose the fat pads, like they're gone.
They're gone forever. Okay, good to know. So that is actually a negative outcome, right? Of that fast weight loss.
Yep, exactly. So, but that's just aging, and then the accelerated weight loss in general too. So,
and then just quickly, when you're doing that type of weight loss, like you said, you see that look, but you also see that will that laxity of the skin kind of go back after time, though? I guess that's a question I've always had. So, like the skin is coming down kind of because it's like, there's nothing there. Will that go back, or do you have to have some type of surgery?
No, probably more surgical intervention because like even if you put filler in, you're not like improving the elasticity of the skin. I mean, you're just kind of putting the hyaluronic acid basically back in there just as like a place filler. But the elasticity, I mean, once that starts going, and that's again like aging and sun damage, mostly sun damage more than anything for the elasticity. But yeah, that at that point, that's when I'll be like honest with patients, like if they have like volume loss, but then it's also like sagging, and like I can just tell like the elasticity, like you just need a facelift at like a certain point in time too, because I mean you just gotta pull everything back and retighten it, just because like the filler, you'll fill it up, but like it's ultimately still gonna sag in certain areas, and so at that point you just gotta surgical intervention to pull it back.
Okay. So I want to talk about skin health, but you said something really interesting, but you just have to do plastic surgery. And you said it so casually. I'm like, hey, I think everyone kind of considers that at a certain point. Like I see a lot of my friends who are a little bit older. They're like, hey, I'm going to do this and this. Are you seeing more and more people kind of say, yes, medical aesthetics can only get me so far, and I'm going to do some plastic surgery. Is it more and more common for plastic surgery now?
Yeah, I would say so. I feel like a lot of my patients, whether they tell me or not, like I'll at least like see the surgical scars when I'm doing my skin checks and noticing like how many people have like facelifts. So it seems common to me. And yeah, that's what usually depending, because I mean I'll even get like patients in their 70s or even close to like 80. I had a lady today who was almost 80 for filler, and just I tell them I'm not like there's a certain point in time when you probably need plastic surgery if to kind of get the results you want. I mean, it's downtime and it's more expense, but then filler is also kind of like breaking down. And you got to keep up with that too, and so I just tell them like the result differences between the two, and if they want to try filler first, I'm happy to do it and see how they like it. But then ultimately, like if it's not getting where they want to be, then like doing surgical intervention is the way to go. And so that's like a talk depending on like the age range, like I'll have with a lot of the patients when I do filler consultation too.
Yeah, no, it's at some point you just got to be yourself, right?
Yeah, exactly. Yeah.
Like, um, I think that's important for people to recognize too. Like this industry is not going to change who you are as a person. It might change temporarily some of the looks, and you might get some really interesting results. But at some point you have to realize I've got to be who I am, and not this stuff won't change. Hopefully, as you get older, right? My thought is always like, yeah, maybe I will do some type of cosmetic surgery down the road, but there's going to be a point where I'm like, I'm really good with it, right? So taking ownership of that I think is super important.
Realizing results are not always like we're not magic workers, right? That's what I tell everyone, because like even you have to preface everything in cosmetics with, I'm not a miracle worker. Like we're making things subtle, and like we're gonna do our best to fill it in. Like it might not be what you want ultimately, because sometimes people just aren't happy. But you got to preface every cosmetic procedure with that.
Yeah, absolutely. Well, then let's talk about skin health. I feel like I said everything was about this augmentation of things years ago, really calmed down to a natural look. And now we're really focusing more on skin health, which brings us to like medical grade products, but more specifically the ones we've seen on the market, like Sculptra and SkinVive. And I feel like there's going to be more coming. What are your thoughts on products like that help rejuvenate the skin from underneath and hydrate it?
So, I mean, I think they have a place, especially, I mean, Sculptra, because Sculptra was out for a while, and then they just kind of like reinvented it and brought it back to market. And so it's still kind of like a filler. I mean, it's the volume, filling space there too, but it's also, I mean, the goal of it is to kind of reteach your body to kind of reproduce, the collagen in there that you've lost over time too. And so I think that's great, especially in areas where, in men, for example, like you could do mid face or like to kind of like make the jaw more like square, or like the temple area too. And for women, I mean, you can kind of do the same areas, but we're doing more rounded. But I think they're gaining more popularity, and I think it's helpful, and that's more longer lasting than doing filler too, which I think is better, because then ultimately you're saving patients money. Too, because we're always trying to be cost effective, but I do think they're gaining steam. We don't get a lot of people coming in asking for Sculptra yet, but I think they're gaining popularity for sure, and I think they can be helpful.
Yeah, that's what we love both those products at Urban U, but SkinVive, which is a newer product, right, is really about the hydration of it,
right?
And I had it a couple of weeks ago, and I'm actually already seeing some results. So I think that's good. But to that point, I guess it's like if we're talking about men specifically, rather than talking about any type of augmentation of any service, it's like just focus on skin health. Like we said, start that at a young age, but even if you're a little bit older, whatever spectrum you might be at, make sure you're taking care of that skin, because it's the only one you got.
Exactly.
And, I so appreciate our relationship we've had for the last couple of years, always a wealth of knowledge. But you also joined MISpa with me, Michigan's Medical Spa Association. So excited that you're a part of it. What made you join besides me calling you?
Besides you calling me. No, I think it involved like a lot of our conversations with how you run your business, and like the whole goal behind MISpa, because we've talked about the aesthetics industry is blowing up. It's just like it's a rapidly growing, and we talked about this when our first meeting, that dermatologists and plastic surgeons, we already have had med spas, and there's med spas out there, but now it's growing at like probably like a rapid pace, and sometimes an unsafe pace, because depending on who's starting a spa, you don't know what their background is, you don't know who's training them, and then just from our viewpoint, what we always see is like we get patients who come up with like complications or issues that happen at like a place, and it probably comes due to a lack of regulation and a lack of training. And so I feel like the goal of this whole thing and why I was interested in doing it is that we want to get like regulation, at least within the state of Michigan, but hopefully, I mean, you can get that across all the states, but just to kind of make sure that every medical spa is the same in terms of like their expectations, their training, and monitoring. Because I mean, ultimately, we want to make sure the patients are being taken care of in a safe way and having things done correctly too. Because while we go to school for many years to learn the things we're doing, some people don't get training at certain spas and just can kind of like quickly learn to do it, and then not knowing like the anatomy or like the complications that can happen too, and it can be dangerous. So that's what got me interested in being a part of MISpa with you, is just creating like a regulatory body in the state to try to help get people to kind of be on the same page with, we need to train people, we need to do this right, we need to mitigate complications, and we all need to work together as a community.
Yeah, no, I love it. Well, and I'm so glad you're a part of it because, as you said, so when derms and plastic surgeons have had med spas for a long time, and this number just came out when I was in Miami recently, that med spas are at like 65% compared to dermatology and plastic surgeons being the remainder. So it used to be the opposite, right? Like the med spas are just moving up. So with that kind of growth that we're seeing year over year, and especially what we're seeing now is we're seeing a lot of solo salons. We're seeing a lot of people who are just doctors who are just purchasing it for themselves, and they might be in an industry that's never dealt with the anatomy, right? So like a pediatrician, even though you know a lot, or even as an ER doc, whatever it might be, like you should be trained to do these services. And with that growth, you're not going to get it the same work that you get as a dermatologist. So yeah, I'm really, really excited you're a part of it. When you're looking at, MISpa, like what are the things that, you feel, if someone's looking to be a part of the association, like what things, besides what you just said, like what things should they really be looking at in their business, that's maybe lacking that MISpa can offer?
Yeah, I think, I mean, just like some of like the first, meeting we had where we talked about like marketing, which was like very eye-opening for me because we do everything incorrect with marketing in our practice. But I feel like it's a good place to learn different tools and tricks that you probably don't know, whether we talk about like different devices to use for certain conditions, or, correct ways to do certain procedures, or just like, helping you with advertising. I think that's like, those are like the three main draws of joining it, aside from just like being a collaborative group. Because like in medicine, it's always helpful talking or bouncing ideas off other people, showing something if you're not quite sure. Say, hey, like I have this interesting patient, and I want to get some like input and like what you guys would do. I think that's like where like a MISpa would really kind of shine and would benefit someone trying to join it.
Mm-hmm. Yeah, no, it's interesting. We got a lot of feedback from that meeting, and your presentation. We brought Adam in from around the world, and your presentation was the one that we continue to get some more questions asked about. So, yeah, so congratulations. I mean, that was the best present. I'm like, wow, Kurt, that was amazing. Your presentation was around men and medical aesthetics. Like, what does that look like? Everything we just talked about. So, well, thank you for sharing your time with us today. I know you have really short time. You probably skipped lunch to do this, so we appreciate it. What is next do you think that the med spa industry in general, or anything you want to share in regards to medical aesthetics?
So what's next? I mean, I think just, we talked about like the growth. So I think what should be next should be more like, kind of getting things under control with like respect to like a regulation. I think that's like something, because, it's as physicians working with medical spas, I feel like that's where we need to kind of like say, okay, like things are growing. We should probably like make sure we have like rules in place to kind of protect everything moving forward, and make sure like everything is kind of uniform so that everyone's doing the same thing across the board. I think that's what should be next, because like you said, the growth is just kind of, well, 65% more med spa versus, dermal plastics now. That's probably going to even jump to like 75 and 25 probably like in a year or two, just at the rate things are going. And so I think trying to get, I think getting more involvement from like dermatologists and plastic surgeons in the space, and owning the things that we are taught to do, and helping other people learn the right way to do it, because it's not like you're going to stop doing the practices, people aren't going to shy away from the med spas. They're going to continue making them. So I feel like having an impact on the community, like with MISpa, or like in other states, is going to be important moving forward and should be happening.
Yeah. Let's get some more plastic surgeons in there.
There you go. Exactly.
It's such a great, like what you're saying. I was thinking, gosh, we should actually bring in a whole bunch of plastic surgeons and dermatologists and like do some training around that for everyone else, which we will be doing training. Anyone listening who's a part of MISpa or wants to know more about MISpa, we have a big training event coming up in January. And actually I haven't asked you yet, Kurt, but I'm hoping you can do the same thing you did last time, but we'll talk about it later. Well, thank you again. And how does everyone get in touch with you? What's the best way to watch what you're doing?
So I guess to reach or to find us our website. We're Dermatology Associates of West Michigan, and you can find me there. And then also if you search me on Instagram, KurtAshack.derm on Instagram is probably where I'm the most active with social media, as I'm trying to get more and more into that realm. So those are the two places you can probably find me.
Awesome. Thank you for your time, and thank you for spending your lunch with us. I know you probably skipped it.
Yeah, that's all right. But thanks for having me.
We're looking forward to 2024 in the Beauty Standard. Get involved by becoming an Urban You or Urban You for Me member, joining MISpa, or by simply leaving us feedback through the sheet in this episode's description. Thank you for your continued support.
Thank you for tuning into this episode of The Beauty Standard by Urban You. This podcast is here to inspire, support, and deliver what you need to hear today to continue on your wellness journey. Check out our Instagram at The Urban You or website www.theurbanu.com. If you loved today's episode, we'd love for you to leave a review and share. Thanks! Go on Instagram and follow us for more skincare education, giveaways, and how to get the best values for the products that you love. @UI for me.